If you talk to most people, most physicians even, what's a platelet, what's it doing? They're going to say, it's there for blood clotting. So if you cut yourself, platelets come in, they stick there here, they form a blood clot, end of story. But I think what's become more appreciated is they do have this very pro-inflammatory role. Because if you look at the platelet, they're very tiny. So which is, we don't respect little things, I guess, but they're very tiny. Cells. And I think because of that, people don't realize how packed full of granules they are, and all these granules are packed full of all these inflammatory mediators and all these other mediators that we don't even know why they're there. I mean, there's been this great, over the last 5 years, in platelet proteomics as well, where they're looking at all the different proteins in platelets, and it's crazy what they have in these small cells, and what their roles might be is only speculative. Because platelets for a long time have really just been looked at as having a role in thrombosis. So there's all these other aspects to the life of the platelet, which kind of get lost in the shuffle, which I think are starting to become more appreciated for their general role in just vascular homeostasis in general. So I think that's one of our goals through these two reviews we've written, is just bring them to the forefront and say, platelets are important. They have these other roles that are less explored. So hoping to introduce it to the greater transplant world. And I think in the settings of transplant or malaria or atherosclerosis, the second pro-inflammatory role sometimes gets out of whack. And if it's a sustained where the platelets are adhering and dumping their granules, then you push yourself towards this pro-inflammatory phenotype or setting, which is bad. So this pro-inflammatory effect is good when you want to make sure you don't bleed to death, or you want to make sure you don't get a septicemia. But it can be bad in these cases where in our modern life where platelets aren't adapted to be able to handle a transplant or our high-fat diets or what have you. So that function of platelets then gets out of control when that platelet localization is sustained. So it's kind of a double-edged sword, I guess. We stand in our lab is that we've now, I think established the fact that platelets help to recruit the white cells. And now the next step is how. What are some of these molecular mechanisms? And that's kind of the path we're going down now, is how the platelets are talking to the white cells, both locally and systemically, to help. Platelets get pulled into this picture once you get the blood vessels, the endothelial cells activated. And once they're there and get activated, they dump out so many pro-inflammatory molecules, and that helps to then recruit the white cells and really drive this vascular inflammation, which is the first step in transplant rejection, really, is it really begins at this vascular interface, because the white cells need to interact with the endothelial cells in order to get localized, to get stimulated, and then to traffic across the blood vessel and really drive this inflammation. And one of the things that we're studying is graft arteriolosclerosis, which is also like atherosclerosis, except it's more of this proliferative smooth muscle lesion is what you see. So we're trying to model that in the mouse model, and trying to look at the role of platelets in driving that graft arteriosclerosis, and as a result the eventual decline of the organ.